Hello, everyone. Thank you for coming. Welcome to NAUTO's 39th Annual Conference. We will be starting in about 1 minute. Before we begin, we want to cover a few housekeeping items. On your attendee screen, you can enter comments or questions in the chat. We hope you will take advantage of the opportunity to engage with our speakers and other attendees. This session is being recorded. We recognize and thank the California Healthcare Foundation for being our Petabyte sponsor. Information about all conference sponsors is available in the sponsor area of the platform. Please take a few minutes to visit each sponsor's booth where you can find information about them and find game tokens. Game tokens are keywords or phrases used in the token hunt game for a chance to win a prize in the daily drawings. Now, let me turn the stage over to Charles Hawley, NAUTO's Director of Projects. Charles, the stage is yours.
Thank you, Erica, and welcome everybody to this session, The Keys to Understanding Healthcare Costs Using Data Visualizations to Drive Health Policy Change. This session is sponsored by Mathematica, and I would like to take just a quick moment to allow Sandra Chow with Mathematica to offer some brief remarks and introductory remarks for this session.
Good afternoon. My name is Sandra Chow. I'm a senior researcher at Mathematica and have worked with states and the federal government to design, implement, and evaluate novel approaches to addressing healthcare costs, quality, and access issues for the past 9 years. Mathematica is proud to be a NAUTO sponsor. We are grateful for the opportunity to participate in NAUTO conferences because of the opportunities to share knowledge to advance and improve healthcare data collection and the use of the data. We are a mission-driven organization, and our goal is to serve public well-being by using data and evidence to drive decisions that will improve healthcare quality and make healthcare more affordable, accessible, and equitable for everyone. We love our work, and we especially love collaborating with our clients and partners, many who are at this conference today. Working with Norm and Charles, we are so pleased to organize and moderate this session, The Keys to Understanding Healthcare Costs Using Data Visualizations to Drive Health Policy Change. We're excited to share our work in Connecticut, where we built multiple dashboards to help Connecticut's Office of Health Strategy better understand drivers of healthcare cost growth. We also look forward to learning from the team at the Oregon Health Authority, who will also share insights related to health spending data visualizations, and from Onpoint, who will share common pitfalls when producing complex data visualizations. We've had the pleasure of collaborating with both Oregon Health Authority and Onpoint across several state projects and truly value that collaboration as we work together to bring forward data insights that can help improve healthcare. Big thank you to Norm and Charles for all their work in making this conference possible. And thank you to everyone for listening in. We hope that these presentations will foster our continued collaboration and learning. We look forward to your questions and insights following the presentations.
Thank you, Sandra. And let me continue the gratitude train here for just a moment and say thank you to KeriAnn LaSpina, who, as Sandra alluded to, organized this session and is actually one of your presenters. But I will let Mario Marchese, who is this session's moderator, introduce folks and get us started. So let me bring Mario to the stage. And Mario, please correct me if I butcher your name. I apologize. I should have asked up front.
You did a fantastic job, Charles. I appreciate it.
Thank you.
And welcome, everyone. As Charles said, I'll be moderating this afternoon session. Topic very near and dear to my heart, using data visualization and other techniques to understand cost and utilization and drive policy change. And as Sandra noted, we have many fantastic presenters, a few of my colleagues from Mathematica, folks from the Oregon Health Authority, and Onpoint Health Data. If folks have questions during the session, please feel free to use the Q&A Q&A tool. And we're going to be covering questions throughout, and we'll leave time at the end to have a larger discussion with the various presenters. And with that, I'm going to welcome our first presenters. We're going to welcome KeriAnn LaSpina and Moein Eshfagh from Mathematica to the stage.
Good afternoon, everybody. My name is KeriAnn LaSpina. I am a senior health researcher at Mathematica, and today I'm going to be showing you some interactive dashboards that we built on behalf of the Connecticut Office of Health Strategy. So some quick background on the project. Mathematica contracted with OHS to assess healthcare cost drivers. This project serves to complement the state's healthcare benchmark initiative. And so what we did was, using claims data from the state's all-payer claims database, we built 3 dashboards in Power BI to assess cost drivers. The cost driver dashboard is kind of just a general high-level view of costs in the state. The retail pharmacy dashboard drills specifically into retail pharmacy spending, and the hospital dashboard drills specifically into commercial hospital spending. Currently, the dashboards are not public, but OHS is working on making them public in the very near future. So before I show you the dashboards, I wanted to just cover the 3 key measures that you'll see throughout all of them. The first one is spending per member per month. This just helps us look at general spending trends, and it's actually a function of our other 2 measures, which are payment per unit, or PPU, and units per 1,000 members, or UPK. So payment per unit is really a measure of unit cost. So for example, the cost of an inpatient hospitalization or the cost of a 30-day supply of a drug. We think of it as kind of a proxy for price, but it's really based on like what was paid for the claim by the insurance company and by the patient. And it's affected by things like service mix and case mix. And then the third measure is units per 1,000 members. This is a measure of volume, so we can monitor trends in use. And when we say members here, we really mean member equivalents, or member months divided by 12. Okay, so I am going to pull up the cost driver dashboard. So this is our first dashboard. As you can see, we kind of start out with this glossary and guide tab, where we provide an overview of the purpose of the tool, key definitions, and an overview of each tab. The next tab here, the cost driver summary, this provides all 3 key measures by market and year, stratified into medical and pharmacy claims, and it allows users to filter by service category, submarket, age, gender, and county. So this is really a snapshot of all the data in this particular tool. And so for each of our 3 key measures, we have 2 tabs. The first is kind of a chart that lets us just look at trends really quickly by market, submarket, and medical and pharmacy. And again, if we want to, we can filter this down to look at a particular service category to see trends in just that category. We also have a map tab, where you can kind of see in the state what's happening with costs. Again, here we can filter to specific service categories or to a particular market. You can also like select a particular county, and that'll show up on the map. You can select a particular zip code down here, and you can kind of see how everything's interactive here. So like the map shows 2023, but if we click on 2021 over here, the map changes to 2021. And so again, we have both a chart and map tab for each of the 3 key measures. And then finally, we have a tab that summarizes the data by service category and year. So this just, again, helps hone in on particular service categories with the greatest spending. So what we found from the cost driver dashboard was that some of the major drivers of healthcare cost growth was from retail pharmacy spending and inpatient and outpatient hospital spending. So that's what motivated us to build our additional 2 tools. The drug dashboard drills down all the way to the NDC level, which I'll show you, and the hospital dashboard drills down to like a procedure category level, and for the inpatient side, a diagnosis related group level. Okay, so I'm going to pull up the retail pharmacy dashboard next. So again, we have the glossary and guide tab, same look and feel. The next tab here is the retail pharmacy. Here you can select a particular measure and just look at high level trends for that measure. Now on the next tab, we bring in the drug category. So the drug category here is something that comes from a product called Redbook. It's a licensed product that classifies NDC codes into these categories. What you can see here is we have a lot of spending from immunosuppressants, and hormones are our top two. The next tab shows the 3 key measures by year and drug category. And you can filter to like specific categories. You can filter by generic brand. So here are our category filters, generic brand. This one's taking a second to load. Here we go. So this is just a kind of a table of each of the categories and the 3 key measures by year. The next tab allows you to see trends in the selected category. So you select your categories down here. If you remember from a couple of tabs ago, we have immunosuppressants and hormones are responsible for a lot of spending in this. So let's take a look at payment per unit. So here you can see immunosuppressants are very expensive for a 30-day supply, whereas hormones are not as expensive. But since we know that hormones and synthetic substitutes are costing a lot of money, we can kind of intuit that it must be driven by a lot of volume of use rather than a high price tag. And we can check that. Sure enough, a lot more use among hormones and synthetics. Immunosuppressants are less use, so we know that that spending's driven more by that payment per unit. The next tab allows you to compare specific drugs that are responsible for either for the highest spending. So we know Humira is very expensive, so you can kind of see here what specific drugs are costing the most by year. And then our final tab is a category drill down. So here you can actually look all the way down to the specific drug level, and you can kind of drill up or down in these different ways. So if you wanted to look at this particular drug, you can go all the way down to the NDC level and kind of see what's going on. And these are sorted by total spending. Okay, and finally, the hospital dashboard. I am running out of time, so I'll just very quickly show you one of the tabs. So again, we have the glossary and guide tab, and then I'm going to go all the way over here to the procedure category drill down. This kind of looks like the last tab I showed you on the retail pharmacy, where you can really drill down. You can select a measure up here. Maybe we want to look at PPU. And you can really drill for a specific hospital if you want. You can kind of filter that hospital up here. Maybe we just want to look at Hartford. And then you can kind of start to see, like, for at this hospital, you know, what category of spending has the highest price tag. And then within that, you know, what procedures are driving that. And we sort of go through a similar exercise here for inpatient, where we have these categories, and you can kind of drill down into specific categories to see what's going on. So that concludes my presentation. Thank you very much, and I look forward to your questions.
Great. Thanks so much, KeriAnn and Moein. Really fantastic presentation. I guess, you know, to start off, I'm wondering, you know, obviously building a tool like that is a pretty significant undertaking. A lot of various data inputs and a lot of potential for slippage with regard to quality. So I'm wondering if you can kind of talk through the build process and some of the challenges you faced and some of the key lessons learned in terms of quality assurance to build something that is that robust.
I think one thing that we learned is that it's really a good idea to kind of mock up your dashboard like as a first step. There's like some tools you can use to do that. So you can really kind of get a sense of what you want in terms of look and feel before you get really into trying to build it out in Power BI or Tableau or wherever. We also just had a lot of different eyes on it. We did a lot of different QA from the client and some of our partners and some people here at Mathematica. And we did iterate quite a bit. We found some issues, sometimes with data problems. Sometimes we just wanted to present things a little bit differently. And we hit some roadblocks, I think, with Power BI. Sometimes we kind of had to make some decisions due to limitations with that application. But I think the biggest thing is just planning out, in advance, like what you want it to look like, so that you're not spending a lot of time on just color schemes and things like that can take longer to do in Power BI than they would in kind of just a design application. Moein, do you have anything to add to that? Moein, I should introduce, he actually built these dashboards in Power BI, so he's kind of our expert technician here. So I'd love to hear what you think, Moein.
Thank you, KeriAnn and Mario. So I guess one important key factor here was also the role of our data analysts, who did a great job of making sure we are having the highest standards of data quality and being super responsive to our changes that we wanted to make in the pipeline. And that helped a lot. We had to do a lot of iterations and deciding what happens on the front end and what happens in the back end. And having a great group of data analysts was also very helpful. And as KeriAnn mentioned, we had to do a lot of iterations to make sure, and a lot of testing to make sure everything is robust and everything is doing a lot of functional testing after each iteration. So especially because of Power BI limitations.
Excellent. That's really, really useful. I'm going to ask one last question before we move on, but as I said, we'll continue the discussion at the end of the session. So KeriAnn, you were talking about two metrics in particular, PPU and UPK. And thinking about the broader topic of today's chat, where we're talking about understanding cost and utilization and then driving health policy change. I'm wondering if you can kind of talk through some of the key findings. You talked a little bit about some of the differentiation in the pharma findings, with some costs being driven by PPU, some being driven by UPK. But if I'm the state of Connecticut or whatever entity, what do I do with that information? And are there any tangible next steps that you've seen through this product?
Yeah, great question. OHS is using the dashboards right now to really drill in and kind of understand, like, especially with hospital spending, what's going on there. Like, we're seeing a lot of kind of price growth, like, for example, in emergency room visits, and it's not because of volume going up. It is because of that PPU statistic going up. And because the hospital dashboard lets you do it at the hospital level, it can really help OHS kind of see which hospitals they really want to connect with and talk to about what's going on. We also ended up with an offshoot analysis that I don't want to get too into, but we kind of built these market baskets of services in hospitals that I think OHS is planning to use in terms of thinking through hospital regulations and stuff. So it kind of led to another thing, but I think the data you see in these dashboards, because it's very straightforward. We didn't do adjustments or too much fancy footwork like that. So you can kind of see a high level picture and really start to drill into what hospitals are driving this, what services are driving this, and we did see some weird, obviously, patterns related to COVID. So the 2021 years, you got this decrease in volume. So kind of seeing how that rebounded and kind of taking that into consideration when we look at trends.
Excellent. Well, thank you both. We'll be bringing you back at the end of the session. And we're going to move on to our next presenters. We have Zachary Goldman and Todd Hilgert.
Hello, welcome to Visualizing State Health Spending Data to Drive Policy Change. My name is Todd Hilgert, the Interim Design Director of Burness Communications, and today we'll explore data visualization from a communications perspective. This presentation has been informed by the work of the Peterson-Milbank Program for Sustainable Healthcare Costs, which supports 5 states that are using cost growth targets to guide efforts to make healthcare more affordable for everyone. Our goal is to share data in a way that it can be most impactful and memorable. Used thoughtfully, data can help create a shared understanding of the problem with healthcare costs, point to sources and root causes of healthcare spending, and make the case for solutions. But it's important to remember that just presenting evidence doesn't always result in behavior change. When neuroscientist Antonio Damasio says we are not thinking machines that feel, we are feeling machines that think, he's not just being poetic. How we feel can have a literal impact on our thought processes and behaviors. Sometimes if we just share our data, our actual message can get lost. Looking at these 2 charts as an example, we have the number of state and local government public health employees from 2008 to 2019, and then some public health related events that occurred around the same time. Looking at these, what's the story here? Is it that employment really dropped off for local public health employees in 2012? Or maybe it's that the COVID-19 pandemic was started over 5 years ago now? No. We want to show the number of public health employees dropped between the H1N1 outbreak and the COVID-19 pandemic and invite a comparison between how those events both played out. When it comes to data visualization, there are many possibilities to consider beyond what we're used to in Excel. Our overarching recommendation is to keep it simple and choose what best states your point. And the previous 2 charts could easily become 2 line graphs, but because we're talking about 2 very specific points in time and the trend in between, a slope chart actually is more advantageous because it eliminates unnecessary information. Okay, so here we've translated our data into a chart that only shows the most critical information. The key message here is that we have a lot less health workers now than we did last time there was an outbreak. We're spelling that out for the audience. We've also added some color and design flair to emphasize certain parts. Local public health workers had a more extreme drop-off, so we've highlighted that in red, signifying that it's negative. On its own, a viewer is likely to understand the message here, but we can do better. Data alone usually is not enough to communicate your message. People in general remember stories a lot more easily than specific facts or figures. And we need to help policymakers do that with health spending data. Here's an example. In 2019, almost 16% of Oregonians said they delayed their medical care due to costs. Now, without context, I don't know what 16% means. I don't know if it's high. I don't know if it's low. Maybe this doesn't impact me at all. Now we compare this data point with a title and a story to make it much more impactful. Here the title is High Healthcare Costs Are Keeping People from Getting the Care They Need. That's exactly the message we're trying to get across to people, so we're just outright saying it. Now 16% can be kind of hard for people to understand. I can much more easily picture 6 people in a room where one of them has had to delay medical care due to costs, know what that means. And then lastly, we're using a real anecdote of someone who was faced with this terrible decision. And in this case, she had broken her leg and couldn't afford physical therapy or follow-up. And I think when most people hear medical care being delayed, you might think of things that actually could be delayed, but breaking your leg is going to create lifelong issues for her if she can't get proper physical therapy. And this is very impactful. So now suddenly 16% sounds like a huge amount, whereas before I had no idea. If you want your own data visualizations to influence policy change, ask yourself these questions. 1, what is the story? Know what message you want to deliver up front. What will resonate? Know who you're talking to. A politician from one political party is going to be motivated by very different data points than a politician from another. Is my data compelling? Make sure you're choosing credible sources and that the data really underscores the story you're trying to tell. And finally, does it say what you think it says? If possible, test your messages with your audience or a proxy for your audience, and then you can literally ask them if they understood the story and if they found it compelling. Next, Zachary Goldman will explain how they've put these practices to work in Oregon.
Hello, my name is Zachary Goldman. I'm with the Oregon Health Authority, and today I'm going to be talking about Oregon's Sustainable Healthcare Cost Growth Target Program and how we use data visualization. So let's jump in. Before we start drafting a report or any kind of brief, we ask ourselves 4 questions. The first is, why are we presenting this information? What's the point? Secondly, what are we trying to say? What's the key piece of information or the key talking point we want folks to walk away with? Thirdly is, who is the audience? Is it a legislator? Is it a policymaker? Is it the general public? And lastly, how will the audience use this information? How can it be geared towards some kind of effective implementation of something? Let's look at some examples. So in many of our reports, we provide an introductory data viz to orient the audience into how to read the following charts. So for example, in this graph, on the left-hand side on that y-axis, we have dollar amounts, and the higher per person, the higher you are on the axis, the higher is the per person cost in 2021. Then for the x-axis, as a percentage, the higher you are to the right, the higher cost growth it is from year over year. So we have dollar amounts on the y-axis, percentages on the x-axis, and then we have a third dynamic at play here, which is the size of these circles. And the larger the circle size means it's more of a contributor to the overall per person cost growth. So there are 3 dynamics at play here, and we want to introduce the audience into how to even interpret those graphs. Well, let's look at real data. So this is taken from a recent report. This is for the commercial market. Again, on that y-axis, you have the dollar amount per person costs. On the x-axis, you have the cumulative growth for multiple years. And then you have different size circles. You'll see very clearly the aqua or teal color, which is professional services, is both the highest circle, so it's the highest per person cost, and because it's the largest circle, that means it contributes the most to overall per person cost growth. So there are kind of 3 dynamics at play here, and we orient the audience into all 3 before we even get into actual data. Let's look at another example. Here's another introductory data viz we provide for the audience. On the left-hand side, we have entities listed in alphabetical order. And then we have a very clear, bright line at 3.4%. This happens to be Oregon's cost growth target for year-over-year healthcare spending. And then we show some red dots are to the right of the 3.4% line, some are to the left, and some are skirting the line itself. And then you'll notice these gray rectangles around the red dots. Those convey statistical confidence intervals. And it's handy because we don't need to get into the mechanics of how we calculate confidence intervals, but this data viz allows the audience to quickly take away, is the data point to the right fully of the 3.4%, to the left fully of the 3.4%, or is it more on the line? Data. This is taken from our most recent report showing 21 to 22 cost growth data for Medicare Advantage payers in Oregon. You'll see all the names along the left-hand side, and you'll see a lot of variation in terms of their year-over-year cost growth in the Medicare Advantage market. Some are far to the left of the 3.4% target. Some are far to the right, meaning they're over the target. Their spending exceeds 3.4%. And a handful are right on that line, given those confidence intervals. So this allows the audience to, again, quickly take away. There were 4 that exceeded the target. They were to the right of the 3.4% line. 3 met the target in that they were to the left of the line. And 3 were indeterminate because they were right on the line or their confidence interval was right on the line. These particular data visualizations and more are included in a lot of our reports. We have an overall healthcare cost growth trends in Oregon. We publish that every year. And we also publish patient cost sharing data in the state, along with many other reports. We have a link down at the bottom to all our reports. I think that's about my time. So thank you very much. We're happy to answer any questions. And if you have any follow-up questions, feel free to email us anytime. Thanks so much.
Great. Thank you, Todd and Zachary, for a great presentation. I also want to recognize that folks did drop comments during the last presentation in the audience Q&A, which I did not see. We will likely get to those at the end of the session, so I apologize. So Todd, I want to start with you. You started the presentation with a quote to the effect of presenting evidence doesn't lead to behavior change, and then you kind of go through assessing efficacy of visualizations using 4 questions to kind of frame how you get there. And I wonder, from your perspective, if you can kind of talk through the extent to which that's an iterative process, right? Like we try to answer those 4 questions initially, we put something out into the ether, and then we have to react to it, and what that looks like from your perspective.
Yeah, for sure. So I'm approaching this as a graphic designer and a designer in general. So that's kind of why my focus is on like how we're presenting the information in this. But I mean, in this exercise and in all design exercises, we kind of talk about like this double diamond approach. So you have your initial idea and you're iterating and iterating, and then you edit yourself, and then you test that with an audience or a proxy audience and get their input, and then you're fixing it through more iteration and then narrowing it down. So that's kind of how I'd recommend you approach like any sort of design project. Is you're kind of brainstorming iteration, you got your first idea, and then you test it and see if it works. And then that's its own little iterative editing processing. But really, it's like the double diamond 2-step process is really effective.
Very cool. Thanks, Todd. And kind of related, Zachary, you mentioned confidence intervals. I think everyone's ears perked up on this call because, we're all a little nerdy. But of course, to the general public, that might not mean much. But it's really important in the way you assess the extent to which a given payer performed relative to the cost benchmark. So you kind of need to show that, and it needs to be meaningful. But you also don't want to get sort of bogged down in the weeds of that concept. And you talked a little bit about how you approach that, but I wonder if you could talk a little bit more about internal discussions you had about kind of designing that visualization to meet the needs of the audience.
Yeah. I'd say our first inclination as a certified data nerd is to put the data in Excel, make a quick table or a graph, and move on. But I think it behooves us, and to be fair to the audience that you're designing the data viz for, to think about, well, what is the real actual takeaway? And it's likely not all the data that we're including in the data table. So to those ends, I'd recommend, designing a couple really thoughtful data viz examples. Ask yourselves the questions that Todd brought up, ask the questions that I had in my presentation, and then test them within your own organization. Send a couple data viz to other colleagues who maybe aren't working on the same project, and ask them, what is your takeaway here? And if it's not what you want the takeaway to be, then go back to the drawing board. It takes a lot of time, a lot more time than you think it will, but it really has great returns. And it really means that folks reading your reports are going to understand the content so much better, and it's more memorable.
Excellent. Well, thank you both. We'll bring you back on at the end of the presentation. And now we're going to move on to our final presentation. And I'm going to welcome Sam Chick and Ryan Houseman to the stage.
Hi, everyone. My name is Sam Chick. I'm the manager of the data visualization and reporting team here at Onpoint Health Data.
Hey, everyone. I'm Ryan Houseman. I work on the reporting and visualization team alongside Sam at Onpoint.
So today, we're going to talk about some of the common mistakes that we see folks making when they create data visualizations. Some of these topics will be more specific to healthcare data viz, but all are really sound principles to follow for any type of data visualization. So when I searched for quotes about data visualization, I found a lot of good ones, and you'll see some of those later too, but none of them made as good a point as succinctly as I think this one did. All of the points we're about to make can, I think, be tied back to this one uniting idea that if you have to explain your visualization to your users, then it's not a very good data visualization. And you might say, okay, that's easy to say, but how do we actually make a good visualization? So we'll try to tell you here. So the first principle we want to hit on is to avoid showing too much data. And I'll add a parenthetical to that, which is avoid showing too much data at once. I'm sure everyone here has experienced this. You go to read an article or a chart or an email, and you take one look at it, and your brain just goes, yeah, nope. The fact is that if you put too much on the screen at once, users are going to disengage. And this is especially tempting to do with healthcare data, as it's often so vast and rich that it feels like you're doing the data a disservice by not presenting as much of it as you can. But just because you can put something into a viz doesn't necessarily mean that you should. So when you have a visual that you think might be too much, too complex, ask yourself, what conclusion do you want users to be able to draw from your viz? And are the elements you've included helping to emphasize that point or obfuscating it? So in this example, excuse me, I took this terrible original viz, which was kind of in a roundabout way, attempting to show which counties had the highest cases of flu. And I reworked that to remove all the visual clutter that wasn't driving towards that specific point. So if you have something you really want to show, but it doesn't tie in nicely with your current viz, that's great. Put it in a separate viz, put it in another dashboard, or add a filter or control to your current dashboard that allows users to switch to it once they digest that first wave of information. So the flip side of that coin, beware of having too little data, and by that I mean incomplete data. So another quote that I thought about including in that intro slide was garbage in, garbage out. If the data you're putting into your viz is incorrect or incomplete, then the result is going to be at best confusing and at worst misleading. So take this graph where I compare a measure for a county to the state average over a 12-month period. Now, for whatever reason, the data for that county is missing the last 3 months of the year. Now, depending on the software I'm using to create my viz, it might plot this data in a couple of different ways. So in the first case, it sets those missing results to 0. That's not great. In the second, it doesn't plot the missing points at all, but it still shows the incomplete months. And then in the third, it removes the missing months altogether so that viz just ends at September instead of December. Now, I don't think 2 and 3 are necessarily that bad. They might raise some questions with your users about why the data is missing, but at least it's fairly clear that it is missing. 1, though, is pretty tough. That's very ambiguous. Is the data there missing, or are the rates for those months actually 0? We don't really know. So my point is, don't leave it up to your software to decide how it's going to plot your missing data, and don't leave it up to your users to know how to interpret those results. Add a note, a title, an annotation, something to make it clear that how any missing or aberrant data should be interpreted. The last principle I'm going to hit here is understand who your users are. Excuse me. One of the biggest mistakes I see folks make when starting to build a dashboard is not answering that fundamental question of who is this actually for? If I'm writing an email to my parents or my boss or my rec sports team, it's going to be written very differently depending on who it's being sent to, even if the content of that email is the same. And data viz is no different. Your intended audience should determine the complexity, the specificity, the volume of the content of your data viz. So if your audience is, say, providers, researchers, or just users who you expect to be familiar with the ins and outs of healthcare data, then you can and you should dig further into the data, use more complex terms and measures, and leave your visuals maybe a little more open-ended, like this graph I've included here. On the other hand, if your viz is public-facing or intended to be used by executives or decision makers, it's certainly better to keep things simple, high-level, and digestible. Sometimes a single sentence can provide a lot more insight than an entire dashboard full of data can. Now I'm going to kick things over to Ryan.
Thank you, Sam. So the next principle we'd like to cover is about providing context. A dashboard should include all of the necessary context so the user can easily interpret each of the different visuals. KPIs, or key performance indicators, are a great way to introduce a user to the main ideas of your dashboard. Titles and labels should also provide sufficient descriptions for a user to understand the meaning of the different metrics or results that are displayed. For example, the solid blue KPIs lack the information needed for a user to clearly understand what they're actually showing. A 0.1% flu prevalence in the broader context of your dashboard is vague and unuseful. On the other hand, the bordered KPIs include a bit more description and are therefore significantly more effective. In more complicated visuals, tooltips are an excellent way to maintain visual simplicity, but also provide the specific information required to interpret your data. Next slide. Avoid misleading color and contrast. It's critical to avoid color palettes that can lead to biased or confused interpretations of your data. The map on the right lacks proper labeling and displays the counties with the lowest flu prevalence in red. This is opposite the conventional perception of the color red and can be confusing for users. For maps, in particular, continuous color scales can turn your regions into a bowl of visual porridge. Step color scales are generally preferred, and in these cases, tooltips can be used to show the exact values of the data instead of relying on a user to judge between two very similar colors. Additionally, red and green diverging color palettes make visuals less accessible for colorblind users. With the exception of astroturf fields, should be green, it's best to avoid those colors. Our final key principle is about the use of visual flow to your advantage. The purpose of a dashboard is to tell a story with your data. And for this story to make sense, the layout of the different visuals needs to consider how a user is going to read your dashboard. Users should interact with the summary visuals or KPIs before they navigate to more granular or complex graphics. Each visual should also add something new to your dashboard, but overlapping elements should be consistent between visuals. In our example here, you can see that we've used the month October of 2024 in both the KPIs as well as the map. Another example for consistency in your dashboard is to add dashboard actions that can control parameters or filters that are consistent between different elements. Back to you, Sam.
Great. So to wrap up, we wanted to show a comparison between those same two dashboards that Ryan just showed to illustrate the concepts that we just discussed, sort of like a Goofus and Gallon cartoon for those of you who remember what those are. So again, both of these use the same simple data set that we put together for these demonstrations, but even at a glance, you can tell which one does a better job of communicating that data to a user. The one on the left immediately overwhelms you with color and unnecessary complexity, while the one on the right assumes a broader audience and communicates its key points more clearly. The one on the left fails to provide context for its key metrics and uses a confusing color scale, while the one on the right makes it clear where outliers exist without introducing bias with its colors. Finally, the right-hand dashboard has a more intuitive flow that makes sure users see filters and key metrics first before diving deeper into the data, while the one on the left throws users directly into the fray with no clear entry point to help them along. So that's everything we have for you. Thank you for your time. We hope this has been informative, and we look forward to your questions.
Great. Thank you, Sam and Ryan. As a fellow Mainer, really great to see the state highlighted in the presentation. And Sam, I'll start with you. So you talked a lot about knowing your audience, which I think is crucial to building out data viz. And I wonder if you could talk a little bit more about how best to do this. I mean, obviously, it probably varies depending on your connection with the audience. But if I'm working with a state or a client, what are some key steps to kind of get to understand their vision and be able to intuit how they might want to see the data presented?
Yeah, so I think the key to identifying your audience or how to present to your audience is asking yourself, what are they going to engage with? And obviously one of the best ways to figure that out is to just ask them ahead of time. If you ask them directly, hey, we're building this report for you, is there something you've seen in the past that you think that represents your vision for this? Is there an example you'd like us to work from? Anything that kind of inspired you? Because that can kind of help point you in the direction that they're going to be thinking. And like I said before, you want to ask yourself, what are they going to engage with? So if they're data users, they want to see data. If they're, decision makers, they probably want to see things that are going to help them make decisions, or, distill complex ideas down into, more simple conclusions. I think just trying to either ask them ahead of time or identify ahead of time what's going to get them most excited is going to help save you a lot of time in identifying how to cater to that specific audience.
Great. Really helpful. And we actually just got a question in from Emily. She said, loved your visualizations and data viz principles. What's the best way you've found to convince your clients that simple is better with data visualizations?
Oh, that's a great question. I think, and going back to the presentation before ours, I thought they made a bunch of really good points, and I was kind of kicking myself because I think a really good addition to this presentation would have been, the mistake you want to avoid is ever thinking that you're done, or that maybe you can be done eventually, but thinking you're going to nail it on your first try. And what I mean by that is, obviously, there's always going to be iteration with these dashboards, and so a lot of the time I like to try to take as many of the client's ideas as possible and implement them, because I might think that there's a better way to do something, and they might suggest something, and even if I don't think it's an awesome idea, I'll usually try it at least. And if they suggest a visualization that I think is going to be too complex, I'll usually still try to build it for them and show them and kind of let them come to their own conclusions, maybe with a little subtle guidance from myself. But often, it's the case for me. It has been the case for clients that they might think something's going to look really good on paper in their head, but then once they actually see it, it's it becomes very obvious that that's maybe not the way to go. Especially if you can, also present something alongside that maybe iterates on or reworks that idea that, makes it more simple or visually appealing.
Very, very helpful. As we bring on the other presenters back onto the stage, actually, Ryan, I had a question related to that for you. So during your presentation, you were talking about using tooltips to help with some of the context, particularly if you're trying to distill to something more simple. Do you have any tips for using tooltips? Any sort of best practices in developing effective tooltips?
Yeah, great question, Mario. I think this ties closely back to many of the other questions we've had in terms of making your dashboards simple and digestible. It's easy to throw too many things into the dashboard at once, and the tooltips can be really effective at saving some space, but also allowing a user to interact with the dashboard and see some specific metrics without trying to display too much at once. So I think generally, if you have filters applied to the dashboard and are drilling down into data, it can be helpful within your tooltips to include some specifics about sort of the current views that you have for the data you're looking at.
Excellent. Thanks, Ryan. I'm going to encourage others to continue to chat questions, but I'm going to go back to a few questions we got during KeriAnn and Moein's presentation. And Moein, this one is for you. Ashley asked for rate-based metrics on the dashboard, such as PPU, PMPM. Are those pre-calculated sort of in the analytic file that gets read into the BI, or are those dynamically calculated in the BI?
Well, both ways. Part of it is coming from our analytical files that are, one would be at the claim level and one would be at the member month level. And it was inevitable to have one join, even though it was against my best practices to do that, but we had to do one join in our data in Power BI, and hence having a dynamic calculation in Power BI. So we have used both approaches in tandem.
May I add to that? Just jump in. We did do, I think we tried to do as much as possible in the analytic file to make like Power BI not have to work as hard. So we did have sort of a claim table and a member table that are kind of aggregated to the levels we needed to to create all the different like filters and stuff that we have. And I think what we tended to do was have, I might be wrong about this, but I think what we tended to do was have like the sort of claims, like in per member per month, for example, are the numerator and the members are the denominator. And so we kind of just do that simple numerator over denominator calculation in Power BI, but we kind of already have the analytic file has the numerators and denominators like to make that easy. I hope that helps.
Very helpful. And I think this is kind of, if we take a step back, not talking about PPU or PMPM for this specific example, but kind of thinking more broadly, and I'll bring in Sam and Ryan here, just kind of thinking about dashboard creation. What are some of the key considerations when you're thinking about, for instance, if I think the dashboard you showed was in Tableau, like, does it make sense to try to do some of this, upstream in whatever analytic package I'm using? Let's say it's R, do the calculations in R, have that analytic file read into Tableau versus, I'm going to take some of the raw data, read it in and kind of do some of the calculations downstream in Tableau. I don't know if that's a silly question, but I'm interested to hear your feedback, and others, please jump in as well.
Yeah, I think it's a really good question because there's a lot of different answers to it. Well, I think the answer depends on, primarily how big is your population of members. I think typically, if we've got more than 10 million individual rows, we'll try to aggregate that up. Generally, I think it's usually the best practice, just because it's going to, by definition, make your dashboard or make your data set smaller and make your dashboard more performant. That said, you do lose some flexibility whenever you pre-aggregate. The most common example we run into is counting unique individuals. So, if you have a person level data set that you're feeding right in, you can use a count distinct function within your data viz software. But if you're pre-aggregating, you've got to condense those down into different cells. And then if you aggregate those cells, then you might lose some of that distinctness. You might be double counting people. So that's just one example that we run into a lot. There's other potential issues. Trying to remember any right now, but yeah, especially if we're dealing with a publicly reported data set, we'll always try to pre-aggregate because we don't want to include any member level information in a public dashboard. So yeah, I'd say generally that's the best idea, but there are some specific examples where you'd want to keep that data set member level if it's feasible with the size of your population.
Great, thanks so much. So we had Azealia ask a question, and this was during KeriAnn and Moein's presentation, but I'm actually going to broaden this out a little to Zach as well. There is a question about, is there an idea of what's the most effective tab on the dashboard based on traffic? And so KeriAnn and Moein, I'd be interested to hear your thoughts on Connecticut, and then Zach, obviously your report is the static report, but perhaps you have thoughts on feedback you've gotten from stakeholders about what's effective.
I mean, to be honest, we don't have those stats. Part of it is because they're not published online yet, so they've really only mostly been reviewed internally. So sorry, I don't have a great answer for that question.
I can add to that both Power BI, Tableau, and other tools, as you mentioned, have metrics dashboards that give you all the statistics about how much time was spent, what reports were opened, and how frequently, and also the user flow, like how from which page, where did they go, what filters they interacted with, and we can get all those reports, but from dashboard. But as KeriAnn mentioned, not yet user feedback.
Yeah, we don't have statistics on kind of the hits or clicks on certain pages of our reports necessarily, but it may be helpful to talk a minute about kind of the decision making of what data viz we put in the executive summary, for example, versus in kind of the bulk of the report. You know, we're probably more inclined to do market level graphics in the exec summary versus, you know, and here are the individual payers, you know, if it's quality metrics or, you know, the really detailed stuff we put later on. Also, you know, one of the things we've talked about internally is, you know, it's okay to have multiple examples of data viz as you're walking the audience through, kind of almost like a bite-size approach, like, you know, little appetizers of these data. Even though I recognize that my example was pretty complicated and that you have 3 complicated dynamics at play, but it is okay, I think, to add more data viz to kind of further flesh out the story, and then just pick the ones that are most salient for the header page or the exec summary or the dashboard face, you know, whatever it is.
Excellent. Thanks, Zachary. This is another question that came in during the first presentation. So I'm going to ask KeriAnn and Moein, but then Todd, actually, I want to kind of ask you something related to this. So Hanan says, great presentation. I'm wondering whether you had access to different demographic characteristics, looked into related patterns, if you found any unexpected insights from any outliers. So KeriAnn and Moein, I'll get your take on that. And then Todd, what I'm hoping is after that, maybe more broadly, you can kind of talk about the idea of outliers and trying to think through best practices for visualizing that sort of data.
Yeah, thanks for the question. I think that's something that Connecticut would really like to do. The APCD doesn't have great demographic data besides like age and gender. So that is what we use in the dashboards. We have done some work bringing in American Community Survey data and kind of looking at some trends there by like racial demographic. We didn't bring that into the dashboard though. So, and I don't recall any specific outlier findings. So I'm going to punt on that one. Send it over to the next person.
Maybe we'll go to you, Todd, about the more meta question.
Yeah, I'm trying to think. So, like, I would say the outliers, it depends, like, if you can figure out a good story there. Like, if it's not statistically significant, I feel like you're not required to show it. But if there's, like, a really interesting story there, you might want to, like, take that data point and make it its own graphic to explain. We do a lot of stuff with like childhood nutrition and childhood health. And when you break it down by demographic, there's always some like pretty outrageous disparities. And because that's something we want to talk about, then we'll highlight this is an outlier because of these social ills, that type of thing. So I guess essentially, like, what do you want to say? Does it contribute to your story? Then maybe you want to say, like, why that's an outlier. But otherwise, a lot of times I see them represented as, like, X's instead of something else if people really want to show it. But that's my take.
Great. Thanks, Todd. Super helpful. I'm going to ask one last question. Angela and Casey both had a pretty similar question. I'm going to go to Sam or Ryan on this. The question generally is, do you have advice on improving accessibility in dashboards, particularly as it relates to alternative text?
That is a really good question, and I would maybe ask the rest of my presenters here how much success you've had with this, because I would say our success has been a little mixed. I think kind of as the complexity of your visualizations goes up, the flexibility that some software, we do most of our work in Tableau, so I'd say the flexibility that software has with respect to the things you mentioned, like alternate text and screen reader functionality, kind of goes down proportionally. So again, I think I'd echo my thesis from earlier, which is just keep it as simple as you reasonably can, especially if that's a priority for you. But I would be curious to hear what my other presenters have experienced there.
I'll say I don't think we've made use of alt text, but one thing that we do try to do is kind of have a table of data available, like that will be, so that if there's problems with readability of the graphics, maybe there's a appendix or a supplement, a place where a person can go and just see the actual data in a compliant way. So that's kind of one way that we've dealt with it.
Yeah, and unfortunately, we're going to have to leave it there because we've reached the end of our session. But I want to thank all the presenters and the audience members for great questions. And I'm going to turn it over to Charles to transition us to our next session.
All right, thank you so much. Thank you, everyone. This was really great. I just wanted to mention that up next is a closing plenary session for the day, data availability and governance. It starts in 9 minutes now. I'll see you all over there. Thanks again.